Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
In part one of this series, we discussed where different estrogens are produced within the body. In part two, we discussed expected levels during menstrual cycle and post-menstrual cycle, as well as in part three, now we're going to address the reasons and disorders for replacing estrogen. Restoring estrogen levels, including E1, 2, and 3 to healthy optimal levels may be crucial for physiological functions and can significantly impact health. Here are some of the things to consider. Bone health, particularly, estrogen plays a critical role in maintaining bone density. Postmenopausal women experience decline in estrogen levels, and they have increased osteoporosis. E2 specifically has been shown to help. Cardiovascular health. Estrogen is protective effectively in cardiovascular system often. It helps in maintaining healthy cholesterol levels and promotes vasodilatation, reducing the risk of arteriosclerosis. Estradiol, or E2, seems to be the most potent form. The Women's Health Initiative showed that hormone replacement might reduce coronary artery disease when initiated near menopause. That means initiating therapy. Cognitive function. Estrogen is neuroprotective and maintains cognitive function, especially E2, and may reduce the risk of Alzheimer's disease and improve memory in postmenopausal women. And of course, the one we all think of quickly is menopausal symptoms. Estrogen's highly effective at reducing hot flashes, night sweats, and vaginal dryness. E2, again, are often helpful in that area. Skin health, because estrogen contributes to the thickness, elasticity, and hydration. E3, the weaker form, is often used in topical types of things of this nature because it obviates the systemic type of problems. Urogenital health, again, E3 is often preferred for local urogenital symptoms due to its safety profile. Also, we should look at mood and emotional well-being. Estrogen has been linked to mood regulation. Low levels, you have a lot of mood swings and depression. E2 seems to be very good in helping peri and postmenopausal women. So if you want to choose the right estrogen as just a general measure, E1 is typically weaker. However, E2 is the most potent and best used for bone health and cardiovascular protection, and estrogen produce symptoms. E3 for local types of application like urogenital symptoms. But we need to discuss estrogen replacement in males because it's not commonly discussed. And there are several areas that may be important, hormonal balance being one. In certain conditions, males may experience a hormonal imbalance where estrogen levels are unusually low compared to testosterone. This can lead to symptoms like libido, bone loss, and mood swings. And just like in female, estrogen plays a part in bone metabolism in males. Men who undergo androgen deprivation therapy for prostate cancer may experience very heavy symptoms of estrogen deficiency, being tired and fatigued and hot flashes, and may be a reason for replacement as well. And of course, same with men, mood and cognitive function may be affected. Some studies suggest that estrogen can have mood stabilizing and cognitive benefits. In cases where males experience significant mood disorders or cognitive decline linked to low estrogen levels, hormone replacement may be explored as well as a treatment option. Thank you so much for watching.